I am thrilled to be here with you all to celebrate the day, World Patient Safety Day. I am a director of the Better Birth Program at Ariadne Labs and have been fortunate to work for many years in Uttar Pradesh with several colleagues at the Community Empowerment Lab, as well as colleagues at the Ministry of Health and Family Welfare and among others. So I'm thrilled to be able to introduce our distinguished panelists, and I think we have a slide set up, and I just want to make sure that that's ready to go. So as mentioned by Dr. Lallu and others, we have a series of presentations that's going to take place over the next hour, and we hope to share with you learnings around the WHO Safe Childbirth Checklist implementation and the efforts that have been done globally, particularly in India, but also in the region and with colleagues in Sudan. So I'm just providing a brief bio for each person so we can get to the panel itself. So next is Ms. Farah Diba, a lecturer at the University of Sia Kuala in Banda Aceh in Indonesia, and hear out their checklist implementation and integration of respectful maternity care. Turn to Ms. Farah Diba, who's going to share her experience a little bit in Indonesia, where they use some similar innovative adaptations as to what Dr. Melitha was talking about. And wonder, Ms. Farah, if you could share with us about your work in Indonesia and the adaptations that you made at the Safe Childbirth Checklist. Over to you.
Thank you, Dr. Katherine, and good evening, good morning, and good day for everyone. Thank you for CAHO for this opportunity. I'm the representative of the joint collaboration project between University of Sia Kuala and Georg August University, Germany. We did this implementation of the Safe Childbirth Checklist in 2016 to 2017 in Indonesia, which was the first ever in Indonesia implemented in Aceh province. Today, I'm going to share 2 points of this from my part. First is who are the persons behind the innovative adaptations, and the second is what are the innovative adaptations that we did during this process. So the adaptation process, we conducted several meetings and FGDs, and we invited the chief of the maternal and perinatal ward of the Provincial Referral Hospital in the capital city of Aceh. And we also invite the senior obstetric and gynecology, as well as the professor in the university, the chief of the Midwives Association, some midwives, nurses, and also the researchers. And what are the innovative adaptations that we have for Indonesian Safe Childbirth Checklist after this process of adaptation? And then also we did the pilot in one area in Aceh province. Then we come out with some adaptations. So we have the mother and the baby data on the top of the form to link to the patient's file, so it won't get lost somewhere during the process of the admission until the end. We have the mother's name, age, insurance class, and the GPA. And for all the questions on giving the medications in the form, we put the timestamp just to make a clear information on what the time and the date the medications is given. And in the page 1, we added call for health symptoms like breathing difficulty, fever or chills, and epigastric pain. In page 2, we delayed the gloves, but at the complete delivery set should be available on the bedside. For the baby preparations, we changed the sterile blade to cut the cord to the scissors to cut the cord. And each page 3 and 4, we for the questions about giving the antibiotics to the baby, because in our country, some of the health facilities in primary healthcare, we don't have the pediatricians. So if it happens in the primary healthcare, then the baby need a special care and monitoring. So they need to be referred as soon as possible. And for the questions for the family planning, so we add 3 additional answers. First, yes, was done during that particular phase, or it's already done during the antenatal care, because ideally the family planning should be delivered during the antenatal care. And there's also option no, will be done later. And on the danger sign list, we add on the cord treatment as need to seek help if the cord infections is happening. And finally, we provide every mother the list of danger signs upon their discharge day with the phone number of the health facilities doctors or midwives that the mothers can contact in case if they found one of the symptoms in danger signs list appear in the mother and the child. So that's the brief information about the checklist adaptations in Indonesia. Thank you, Katherine.
Well, thank you so much, Farah. I really appreciate the idea of adding the phone number to the information that's handed to the woman as she's leaving the facility with her family. That's a brilliant innovation, and not something that's standard on the checklist at all. I mean, that's fantastic. And I think when we think about respectful maternity care, you know, that's part of respect, is how do you contact care when you need help? And that's, you know, I love that innovation. That's wonderful. I think, Ms. Farah, you had a comment about SCC and midwifery confidence.
Yes, I want to add something related to the communications that's developed during the Safe Childbirth Checklist implementations for 6 months. After the implementations, we conducted the FGD to the midwives, and we found that the midwives have so much confidence from the checklist that they have the confidence and more real to talk to the obstetric and gynecology and to others midwives about the patient's condition. So if the doctors sometimes forget about something and then they refer to the checklist, a doctor, you need to do this, and they also put that on the wall. So the Safe Childbirth Checklist poster, we create this poster and they put it on the wall. So every time the midwives sit and just have snacks, something like that, so they can still saw the checklist on the wall. And I check until now that the poster are still there in some hospitals. So it's really glad that they still use this and still sustain until now.
Wonderful. That's great to hear. And I just want to take a moment to say thank you so much to our expert panelists for joining in this wonderful discussion from around the world. Literally all time zones are covered right now. And I want to highlight that, of course, this dedication to World Patient Safety Day and your dedication to achieving safe and respectful childbirth and safe and maternal and newborn care is inspiring to me and the work that I do. But I believe that this panel has been helpful in identifying that it's not always an easy road, but it is definitely progress can be made. Again, I want to thank the leadership for inviting me and allowing me to moderate this panel. It's been really a wonderful experience. Namaste.
Thank you. Namaste.
Thank you so much, Dr. Katherine. Indeed, a wonderful session. You know, it's overwhelming to hear from so many experts across the globe and their experiences, the challenges. And from CAHO, as Dr. Anu said, we are the consortium of accredited healthcare organizations in India. We have excellent stakeholder base, quality professionals, doctors, nurses, administrators, who are very passionate about quality and patient safety. So we are sold to the idea of promoting this safe child checklist. And this year we are going to be taking this as our agenda to motivate more and more hospitals join the journey. And we are very sure that we'll be able to promote this in a big way in this country. And as Dr. Anu said, our partnership is growing, and we'll be able to certainly have training sessions conducted across the country. We are really committed to what we are talking about today. And next year, let's all meet together and see the success and where, after 365 days, where have we gone? So that will be a good thing to look forward to. And thank you for sparing your time. Wonderful session. And thank you for all the panelists for sparing your time and your experiences.